Today we're going to go over the 4 movements of gas and how to use plant-based medicine to influence them. This topic has never been covered comprehensively in English before. We're going to go over the essence of plant-based medicine, Qigong, and how to use breathing and flavors to superpower your health. We first remember that our body functions by way of pumps. Our cells have sodium-potassium pumps, our lungs pump air, the heart pumps blood, our cerebrospinal fluid comes in waves powered by a pump. This is how we create emptiness and how we fill. This is the way a syringe works. It's the way IV works. It's how the body regulates itself. In some areas there should be emptiness. In other areas it should be full. When these are out of whack, the body falls into disorder. If you want to know the key to chronic diseases, why certain medications work the opposite on some people, and why people can go from doctor to doctor without positive results, then listen closely. Once you apply an understanding of how pumps work in the human body, you will be able to maximize your health. To understand how to regulate gases and blood in the body, we have to look at the basic pump, which we all played with as children. This is something we all know about, but few of us really apply this common sense to the human body. Imagine taking a turkey baster and squeezing out all the air, then dipping it into a well of black ink and letting it fill up. It's the emptiness that creates the vacuum that sucks in the black liquid. Now imagine that you have this turkey baster filled with black ink and you want it to be filled with clear water instead. Picture yourself standing in front of a swimming pool. If you were to simply drop the baster in the pool, the exchange would happen, but it would take a while for the water inside the baster to become clear. As far as exchanging the water, it would be extremely inefficient. If you attached a hose to the open end of that turkey baster and turned it on and tried to force clear water inside, the rubber ball at the back would stretch and it would damage the turkey baster. This sounds silly and it betrays common sense, yet when it comes to medicine and health, this is exactly what is happening and this is exactly what's recommended. You know from childhood play that it works best to first squeeze the end to expel the black ink, and then you could fill it again with fresh water. At first it may be a little bit murky, but after a few squeezes, the water inside the turkey baster would become clear. It's not instant, it's not magic, but strategically it makes the most sense. Within the turkey baster, the water enters and exits. The negative pressure will contain air or liquid to get the contents to either enter or exit. We work the same way, only more three-dimensionally. In addition to gas entering and exiting, it will also raise and sink. This creates cycles in the body of gases entering and exiting, rising and sinking. We see this everywhere in nature. Wherever there is water, wherever there is gas, you're going to see these cycles. The human body is no different. Gases exist in the outer environment and within us. We are permeated by these gases and with the bacteria which thrive on them. We are not isolated bubbles existing within the outside environment. We are completely immersed in these gases, and every cell in our bodies depends upon this saturation. The Chinese word for gas is qi, which is often translated as energy in the West. There is certainly an intimate relationship with energy, but it is also the connection between the heavens and our most secret veins. The ancient Chinese recognized that there were 4 basic movements of gas: entering, exiting, rising, and sinking. This is at once vastly complex, and on the other hand, it's a kind of common sense. Consider how you breathe right before you sneeze. You gather gas into the chest. It causes it to rise and enter until you forcefully expel it outward and upward. Hopefully you've covered your mouth. Now remember the down-bearing pressure you may use to expel waste or methane. The body regulates by yawning, sighing, sneezing, vomiting, sweating, pooping, etc. These are all influenced by gas exchange and by the physical action of breathing. Before we go deeper into regulating gasotransmitters, we need to be firmly rooted in common sense and the personal experiences we have all had with our own autoregulation. Consider how the pumps of your body have worked together with your breathing patterns during various states of imbalance and reflect upon how you breathed at this time. There are breathing methods your body will enter into during states of panic and ecstasy, during childbirth or severe pain. This isn't esoteric or mysterious. It's as ordinary as taking a breath when you have constipation or taking that gasp in your chest when the water in the shower suddenly turns cold. This is how your body naturally reacts to change. And if you understand the how and why of what your body is doing, it can be a powerful source of inspiration for your daily health. This is Qigong as I understand it. This is the regulation of gasotransmitters. I've been all over China, particularly in Sichuan. I've met Qigong masters on mountains, and their understanding of Qi is very ordinary. It's extremely down to earth. It's common horse sense, rooted in what your body naturally does. Every breath we take is part of a cycle. Gas enters and sinks, enters and rises, exits and rises, exits and sinks. It's a pump and it's a wave. As you breathe into your lower abdomen, the gases enter and they sink. As you reduce thoracic pressure to inhale into your chest, it causes the gases to enter and rise. As you relax the chest, it causes gases to exit upward and outward. As you exhale from the lower abdomen, it will cause it to sink and exit. It seems simple, and yet we don't always breathe evenly. If gas enters and rises, but does not exit or sink, then it causes an imbalance. This happens with anger. People get red in the face. Over time, it can lead to high blood pressure. To counter this, we sigh. What is that doing? It's causing the gases to exit and sink. This cleansing breath in yoga classes can indeed lower blood pressure. It's a good practice when you are literally stuck up. Yawning is when we take in more air. Sighing is when we expel more. When people are depressed, gas is stuck down and in. To move it upward, we literally inspire ourselves by breathing up into the chest and sighing to complete the cycle. This is one reason why exercise is so helpful for depression. It's hard to find a depressed jogger. It's easy to find people depressed when they're lounging in a chair so that their chest can't fill. It makes the heart have to fight for nourishment. Gas can also be overly expelled when we run out of steam. We literally are running out of gas. We're getting gassed. We're running out of energy. Having too much or too little are both associated with pain, fatigue, and disease. However, it's not as simple as just saying, okay, I need more, or all right, I need less, because these work in cycles. It's just like squeezing the turkey baster. After you evacuate the contents, it creates suction, it creates backflow. At the same time, when you fill to an extreme, you get overflow and it starts to exit. Drawing inward inevitably leads to overflow and release. Breathing methods aimed at sighing are like squeezing the end of the turkey baster and releasing the contents. Yawning is like drawing it in. It creates negative pressure to fill the body with gases. When we hold the breath, it causes the gases to further compress into the body. I met a kung fu master in Sichuan with large fingertips, which he credited with his breathwork exercises. These breathwork exercises would alternate to cause his body to have vasoconstriction and vasodilation, meaning his veins would either close down and elongate or begin to puff up. Just like when you're exercising, your veins will start to pump out a little bit. That's because of the nitric oxide. Breath holding is something that freedivers know a lot about, and what they've discovered can teach us a lot about how we can be breathing in daily life. If you're freediving, your oxygen levels may be just fine, but you can get a reflex to breathe as the nitrogen levels rise. That kind of gagging feeling that you get, that kind of feeling when you're holding your breath, it's not so much that you're out of oxygen, it's that the nitrogen levels are too high. Going into a state where your oxygen levels dip can elevate your levels of gasotransmitters like nitric oxide and hydrogen sulfide and carbon monoxide. As your oxygen levels dip, it signals the release of these gasotransmitters. These serve as stand-ins for the oxygen. You can think of them like temp workers. You lose people at the office, you have some temp workers to stand in while they're gone. Like a temp in your office, they may not be the most efficient, but in cases of hypoxia in the brain or heart, they can do a lot to protect against injury. The trick is to signal the right amount of these gasotransmitters, but also regulate them so they don't become too concentrated. If the levels raise too far, it can lead to hallucinations and eventually become fatal. This falls in line with what my Taiwanese stepfather and martial arts teachers told me about Qigong when I was growing up. They said if the teacher is bad or you don't know how to recognize when Qi is too high or too low, it can cause hallucinations and health problems. Diseases such as bipolar disorder, major depression, and schizophrenia are associated with imbalances of nitric oxide and hydrogen sulfide. This is also a common pathogenesis for almost every type of addiction. When freedivers swim down fathoms below the surface, they hold their breaths for incredibly long periods of time. This causes constriction of the veins. This constriction draws blood to the heart and brain where it's needed the most. This is the opposite of what happens when you're exercising and your veins pop out. In this case, your muscles require blood more than your core. This shift between peripheral and core circulation is not all that different from the pump in a turkey baster. Sometimes it goes out, sometimes it comes in, and the regulation between these two is essential for your health. When the divers are submerged and they lack oxygen for a period of time, it signals the gasotransmitters to kick in. They're signaled by hypoxia, by the lack of oxygen. Carbon monoxide, hydrogen sulfide, and nitric oxide all play roles as the reserve blood in the spleen squeezes out to supply the heart and brain. This is a tremendous and potentially life-saving boost. We don't tend to think of our spleen as being a bag of blood just in case we need it, but it is one of its functions. It's also why sea mammals have such large spleens. It's a backup blood supply for when we've gone too long without air. At this level of hypoxia, many freedivers report feelings of absolute bliss or euphoria. These people seem to get a meditative, spiritual kick out of it. In Taoism, this practice is called the Long Tour, and it also reminds me of David Carradine, not because he played a Shaolin monk on TV, but because he died in a Thai hotel room due to autoerotic asphyxiation. It's not the most glamorous way to go out, but at least he died doing what he loved. Anyway, we know that lacking oxygen can increase nitric oxide, and that nitric oxide is the key mechanism behind how Viagra works. Whether it's to achieve spiritual states, deep sea dive, or just blow off steam in a humid hotel room, it seems that there is something we can learn about the effects of gas exchange to enhance our potential. Would it be possible to use this to gain abilities that other animals have, like overcoming extreme cold or hibernating through winter? In Chinese Kung Fu folklore, there are techniques called hibernation breathing or turtle breathing. Is there any truth to these methods, or is it the realm of fantasy novels and folklore? Bears, carp, turtles, and other animals make use of nitric oxide and hydrogen sulfide during hibernation. This allows turtles to hibernate in the silt of ponds without needing to come up for air. In an experiment in 2005, researchers induced hibernation in lab mice and had them inhale large doses of hydrogen sulfide gas. Later, the scientists gave them oxygen. The mice who were exposed to hydrogen sulfide had no adverse effects. The other ones were really messed up. These abilities for animals to go long periods of time without breathing and to overcome cold have been preserved in East Asia and in India. In Tibet, they have Tumo meditation, which allows people to overcome cold. The monks will meditate outside and have wet rags on themselves, and you can see the steam coming off of them as they superheat their bodies. Wim Hof is a European man who has developed these breathing methods in a very simple method for Westerners. And when you look at his method in detail, I recommend that you do. I have a lot of friends who are using it, and it seems to be very effective for them. I've tried it myself. I have to say, if you want to feel the effects of holding the breath and filling the body with oxygen at a very gross, dynamic sort of way, this is the method to go with. It's not the most gradual approach, but if you want to feel it right away, this is definitely one to consider. He's also put his money where his mouth is. He's risked his life numbers of times, demonstrating his ability to overcome cold, as well as endure prolonged states of hypoxia without incident. Within his method, the first step is emptying. He has people take very deep breaths. This is just like taking that turkey baster filled with ink into a swimming pool and pumping it repeatedly. This is going to just saturate the body with fresh oxygen. Next, he uses a method where he fills the body to capacity with oxygen. This would be just like stretching that rubber ball open just as far as possible. Then, he has people exhale completely and hold. This would be like squeezing the turkey baster and just pinching out everything. The next step is to take a huge breath in and then hold it. Again, this is just like releasing the turkey baster. He's using a combination of yawning and sighing methods between the lower abdomen and the chest in order to completely saturate the body and also to train it to overcome hypoxia. It's important to remember with any breathing method that you're influencing the four movements of these gases. So it's inappropriate for everybody in a room to use the same breathing methods if there are any kind of medical complaints. I'll give you an example. I was watching a Qigong class once in LA. It was a friend of mine teaching it. He'd grown up on the Shaolin Temple, but he had not learned the nuance of when and how to apply these techniques. He had a great method for strengthening the body. It was going to bump up people's nitric oxide. If you're a vegetarian kid on a mountain, this is a great way to increase your strength. However, there was one man in the class with high blood pressure. As he was doing these exercises, I could see the fluttering from his artery, and I asked him what was wrong. He said after the class, his blood pressure goes up. Well, this was obviously a problem. The methods were designed to cause the gases to enter and to rise up. This is exactly the opposite of what he needed. I pulled him aside and said, listen, what you need to do is sigh. You need to exhale with more force and cause a kind of relaxation response. He did this for a few minutes and his blood pressure dropped well below what it was to begin with. Breathing exercises have physiological effects on the body. It's important if you're undergoing a certain type of training, whether it's for deep sea diving or for Qigong or yoga class or meditation. Maybe it's said to just align your chakras or be good for emotions. Take responsibility for yourself, and you need to understand where your gases are, where your qi is. Is it too high in the body? Is it too low? Is it entering too much, or is it expelled too much? Have you run out of steam? Do you need more inspiration? Or do Do you just feel like you need to let something out? So ask your teacher, what is the purpose of this? If they say energy is energy and it's all good vibes, that's BS. Leave. Because that's not the way it's understood by the people who are in charge of the mountains in Asia. It's not the way that doctors are understanding it. It's not the way that yogis are understanding it. That is BS Americana. That's what it is. And it could potentially hurt you. If it's having physiological effects on the body, then there must be a diagnostic process. This is the way to responsibly use modalities of medicine and also use herbs within plant-based medicine. Herbs in Asia are understood according to their effects on these gases within the body. Let's go over some of those effects and how we can know based on the flavor of a plant what it will be doing to the body. So how do you know if you have too much or too little? The easiest way is to just pay attention or ask one of your friends, hey, do I tend to yawn more or sigh more? If you're yawning constantly, then your body is trying to get those gases in and contain them. The breath goes in, and it goes out very slowly. And you can feel that pressure if you really take a big yawn. You can feel it expand and kind of compress inward. Similarly, if you're sighing, you breathe in and you're exhaling with more force. And you tend to do this when you're stressed out, you're annoyed with somebody, you need to let off steam in a very literal sense, and that's what you're doing. If you're not sure which one it is, some people say, I don't know, I don't think I do either. That's fine. Lie down somewhere and just pay attention to your breathing without trying to control it. You'll notice that it may be easier for you to inhale than to exhale or vice versa. You also may notice that you're spending a longer time on an inhalation or exhalation. This is a great way to tell. Another way is based on your state of inflammation. If you're in a high state of inflammation, you haven't had a lot of sleep, you have red eyes, at this point, your nitric oxide levels are going to be elevated. It's important to let off steam first and then to fill it up afterwards. But let's say you're still not sure. That happens quite a bit. I see a lot of people in our clinic and I'll ask them, do you tend to yawn more or sigh more? And maybe it's just kind of tricky to diagnose them because they have no idea. They're not paying attention to themselves. They don't really know. What I'll do is I'll have them purposefully sigh first. And as they're sighing, they will naturally start to yawn if it gets beyond the point that they need. They can't help themselves, they'll just start to yawn. Other people can lie down and just sigh for 3 or 4 hours before they even get a yawn. So you can tell from there where people have an excess of gasotransmitters or deficiency. Understanding that excess or deficiency is incredibly important for medicine in general, and especially for breathing techniques. If you're doing a meditative or breathing technique, remember there are 3 types. There's boosting, which is compressing gas inward. There's expelling, where you're releasing, and then there's regulating. Most meditative traditions that are presented in general to the public are regulating. So you might sit somewhere, you're not supposed to think, you just breathe gently in and out. That's great, but it's just like dropping that turkey baster inside the swimming pool. It will eventually regulate itself, but it's terribly inefficient. And if you're pressed for time, it may be better to understand your internal diagnosis and then take a more active approach, just like pumping that turkey baster to get the black ink out. If you're yawning more, it's a sign that your body is out of gas. It's trying to recharge, it's trying to bring the blood circulation back into the heart, back into the interior. If you do quite a bit of yawning breathing, you may feel that your hands are getting a little bit cool. Sighing is going to help push it outward. With the stress response, that kind of action that happens when you're doing the yawning style breathing happens anyway. It's like people getting cold feet at a wedding. With the stress response, your body wants to pull the blood supply to the internal organs. This is a great protective mechanism if a tiger is biting on your leg. To relieve yourself after the stress and return your blood circulation back to normal, you sigh to gear down, engage the parasympathetic response, and get the blood circulation going to the periphery. If you're yawning more than you're sighing, or if you're taking longer to inhale, that's a sign that you probably could use some sleep. I mean, obviously, you're yawning, you need to sleep. That's what happens when you sleep. Blood goes to the internal organs, you gear down, and you recharge. As you're running, what are you doing? That kind of panting that happens with exercise, that's pushing blood circulation out into the periphery. This is just exactly what happens, this kind of pump that we mentioned earlier. When people are deep sea diving, it's like a big yawn. That breath holding is like a yawn. It causes the blood circulation to come to the interior. With a yawn, you take a deep breath in and kind of hold it. You want to exaggerate that? Hold your breath for 5 minutes. That's what's happening. It's causing the blood to come to the interior. Sighing pushes it outward. This is the basic pump of the body, and once you understand this, you can heal yourself from so-called incurable diseases. I know this because I have many patients who have done just that. It's not all that difficult. It doesn't take a special method. It takes paying attention. And then just thinking, where does my blood need to be right now? If you follow nature, you follow your body, and you understand the purpose of yawning and sighing, of breath holding and hyperventilation, it makes regulating your body that much simpler. This understanding is the foundation of plant-based medicine. We can get a general idea of how plants will influence the movement of these gases within us. As we go through these, it's important to remember that those motions are cyclical rather than linear. This is what gets lost so often. As medicine comes from India and China to the West, people will get these ideas that something is static. The salty flavor will be warm, and somebody else says, oh, well, my guru said it's actually cold, or vice versa. As we go through this, I will explain the nuance of how these cycles work and how to understand them within the living context of the world around you. The flavors of plants tell us what the plant will generally do. This isn't 100%, but let's say it's 70 to 80%. What we're going to go over aren't facts so much as tendencies in nature. When I was little, my mom would take me into the woods and she would say, you can have the blackberries, but if you see berries that are red or white, avoid them. Was it a fact? Absolutely not. But it was a tendency in nature. It was a rule of thumb. This is what we're going to go over. We've gone over how yawning and sighing affect gasotransmitters to cause the gases to either be contained in the body or to be expelled. The same thing happens with plants, only it happens at a more detailed level. Rather than working only with the gases to affect the pumps in the body, when you're working with plant-based medicines, you're working with every chemical structure that exists within us. So there's a level of detail that's a little more specific. However, it still works on these general principles, and that's what we're going to be going over. It's important to remember that the actions that are caused are biphasic. So if I want qi to go out, up and out, I need to understand that if I use a little bit of a substance that makes me sneeze, if I use a lot of the same substance, it may cause me to take very deep, full breaths. So let's keep in mind that there are 4 movements of qi. There are 4 movements of gas in the body. There's rising and sinking. There's entering and exiting. First, let's begin with the vertical axis. Bitter causes gas to rise and sink. What I mean by that is, if you find a plant and you taste it and it has a bitter flavor, it's more likely than not going to cause qi to rise up in order to sink. Remember, these are cycles. It's not just shooting up into the sky. This is a cycle within the body. So it's going to cause the gases to rise in order to sink. If you use a little bit, it reduces water from the body by way of increasing bowel movements and urination. It rises in order to sink. When you drink coffee, it increases the heart rate, and then it causes you to visit the bathroom. The more intense the coffee, the sooner the trip to the bathroom. It's causing the gases to rise in order to sink, and if you want it to have a sinking effect, you increase the dose. So if you have a very light coffee, You probably won't have that trip to the bathroom, but you will have the increased heart rate. If you want to induce bowel movement faster, increase the dose of the coffee. This is a general principle that you probably are already familiar with within the context of coffee and the bitter flavor, but as we go through these flavors and what they generally do, the same rule applies. A little bit will cause qi to go in a certain direction. However, if you use a lot of the same substance, it may have the opposite effect. So to recap, bitter causes qi to rise up in order to sink because it's a cycle. The opposite of this is salty. Salty sinks in order to rise. If you eat a few bags of potato chips and ribs, you will be on the couch fully sedated. This is known colloquially as the itis. That's what they call it in southern states when you've had ribs, honeyed ribs with some salt. You eat them, your digestion can't handle it. It takes all that you can of your blood supply to even get to your digestive organs to try to digest it, and it puts you out like a light. This diet will ultimately cause an increase in blood pressure. So what is blood pressure? High blood pressure is the qi entering and rising. But salty initially causes it to sink, so it's sinking in order to rise. Bitter causes qi to rise in order to sink. Salty causes it to sink in order to rise. Bitter causes the body to dry out. Salt causes it to retain water. So you can see these are kind of opposite. If you have a vertical line, bitter is at the top and salty is at the bottom. Salty sinks in order to rise. Bitter rises in order to sink. Bitter reduces water. Salty retains it. When we work between bitter and salty, we're regulating moisture in the body. Regulating moisture is very important because it will determine how much microbial life exists. If you look at many herbs that are bitter in nature, they tend to be antimicrobial. They have a lot of antibiotic effects. Next, we'll go to the temperature axis, which is the horizontal axis. So we have the vertical axis, which is regulating how much water is in the system. Bitter is going to drain off the water, and salty is going to cause water retention. If you really enjoy salty foods, it may be a sign that you're dehydrated. People who indulge in salty foods too often tend to get water retention. Next, we're going to the temperature axis, which is a horizontal axis. On the left side of the axis, we have sour. On the right side, we have pungent, kind of spicy. Sour foods cause a puckering or contraction, if you think of biting into a lemon. This causes the gases to enter first in order to exit and push out. Pungent foods like chili peppers, wasabi, and pepper can make you sweat right away. This causes gases to exit in order to enter. Generally speaking, sour foods will cause a cooling feeling to the body. Pungent foods will cause a warm feeling. There are exceptions to this rule, of course. The effects of these flavors are dose dependent and also highly dependent on the context of other flavors. When you're making a formula of many botanicals, you're not going to have just one flavor. In fact, even within the same plant, you may get 3 or more flavors going at the same time. To understand them, you have to understand them within the context of other flavors. When they combine, they have very strong effects on the body. If you combine the bitter flavor, which rises first, and the pungent flavor, which exits first, you can think about it. One is causing the body to be dry, and the other is causing it to be warm. This makes your body's internal condition like that of a desert. This is a great idea if you live in a cool and moist climate, or if your body condition has become too cool and moist. You see this with people who often feel cold or are prone to fungal infections. When you give them foods that are bitter and pungent, let's say mushrooms and garlic together, it can cause them to dry out. It causes the edema to go down. It causes the yeast infection to get destroyed. It causes the toenail and fungus to clear up. If you combine the salty flavor, which sinks first and causes a moistening effect, and the pungent flavor, which exits first and warms the body, then you get a warming and moistening effect. This pushes the gas downward and outwards as well. This causes the body to become warm and moist like a tropical rainforest. This would be a good idea if you live somewhere very cold and dry, or if your body has become cold and dry with age. A lot of people who are in need of plant-based hormone replacement therapy will turn to herbs which happen to have a naturally salty and pungent flavor to them. If you combine the salty flavor, which sinks first in order to rise and retains water, with the sour flavor, which enters first and is cooling, then it can make you cool and moist. This is a great strategy if you're in the desert or for people who just tend to run hot and dry. The combination of these, you can think of people who have chapped lips or tend toward constipation. If they have foods which are naturally salty and combine them with foods that are a little bit sour, it can have an effect to retain moisture within the body. If you combine the sour flavor, which is cooling and enters first, with the bitter flavor, which rises first, then you have an entering and rising effect. The sour flavor is cooling, but the bitter flavor is drying. This can make the body cool and dry, and it's a great way to counter the modern diet, which tends to be too warm and moist. This is a great way to adapt to tropical environments and to reduce oxidation. Bitter and sour plants tend to have the highest levels of antioxidants. This is a great way to cool down and dry out. Most of the foods we eat are laden with fats and sugars. These tend to be very warm and very moistening. To counter it, use bitter and sour plants, which have the effect of causing the body to cool down and dry out. Sweet is everywhere, and it's countered by fibrous, bland, less nutritionally dense plants. Fiber creates a slow-release mechanism to sweet foods. In the modern era, where even our vegetables are engineered to be incredibly sweet, we want to aim for more fiber or bland flavors medicinally. Sweet or nutritionally dense foods cause accumulation. It contributes to constipation. Bland and bitter foods let some of the air out of that old spare tire. Okay, this can be a lot for a podcast, which is why we spent a few years writing a book on the subject. If you go to www.botanicalbiohacking.com, you can find the book called Enlighten Weight. Enlighten like enlightenment, and then weight. We made this to help people adapt to the North American diet. You can also go on Amazon and look for Enlighten Weight. Now let's go over some applications. Bill has high blood pressure. Let's call him Blood Pressure Bill. He's eating pizza and beer. This causes him to retain water, gain weight, and increases his blood pressure. The pizza is going to be very nourishing, overly so, and cause accumulation. This will cause qi to enter and rise. His qi needs to go down and out. He's already eating plenty of salt. In order to heal him quickly, it's better not to fight with his lifestyle. The qi is going up, so we're going to continue it going up. This is like Tai Chi or Judo. We're going to go with the force and help it cycle back down. When you have a lot of force going up, it doesn't make sense to fight force on force, especially when we have a track, just like a train track. As a kid, I would kind of play with these wooden trains. It doesn't make sense to push against it. Just push a little harder and it'll cycle through. His qi is rising, so we use bitter, which causes qi to rise in order to descend. A small dose will increase his heart contractility. That's not great. But a larger dose of bitter will cause him to expel water. This will drop his blood pressure right away, just like diuretics do. This would best be done with mushrooms. His body is running hot because of the qi, and it's hard to break down. So in order to give him something sour to help break down that qi, we can use sour pickles or sauerkraut to help break down that accumulation. The sour effects of the pickles and sauerkraut is more likely to stimulate bile. This will help to regulate the gut and help him to break down the qis. The pickles will be both prebiotic and probiotic. It will cause the qi to enter in order to exit. Rather than fight force on force, it's better to ride the cycles and go with the force of the imbalance in order to bring greater health and order to the body. If you look at dietary cultures with really dense, rich foods, you will see that there are mushrooms and pickling traditions that go along with them to help people maintain balance. The mushrooms and the pickles together will cause the qi to enter in order to exit, and to rise in order to sink. This is a great way to counter those nutritionally dense foods which will cause the qi to enter and to rise. There are times, though, that you do fight force with force, but the most efficient path is to follow the opposing force and to keep the natural cycles moving as they should. On the other end of this spectrum would be a vegan woman who often runs cold. Let's call her Cold Katrina. She's susceptible to getting colds and allergies and has many dietary sensitivities. Her digestion and metabolism are slow, and she gets water retention. She is cold and moist and boggy. She gets edema, she's depressed. You see this a lot with people who are very giving, but haven't taken the time to restore themselves. She's literally out of gas, and her diet, both emotionally and physically, has been sour and bitter. She believed that eating cold and raw foods was good for her. Unfortunately, her metabolism became too weak to digest them well. She needs support, she needs a boost. Her qi is going down to the point that it's been draining away and she can't refill the tank. She feels drained constantly and couldn't find the ability to recharge, resulting in chronic fatigue syndrome. In this case, we look at nourishing and pungent herbs like ginseng, dangui, and sweet herbs like huangqi and dihuang. It would also be good to use salty and nourishing herbs like xuanshen and roucongrong. It also would be a great idea for her to add minerals to her diet to cause the qi to go from descending to ascending. This would cause her to warm up enough to begin sending qi upwards rather than leaking too much. Even if she were to just include minerals, ginger, and garlic into her diet, and began actually cooking her foods, it would do a lot to help her recharge her bioelectric batteries. Blood pressure Bill's pattern was due to him being on a pizza and beer diet. He was overnourished, and it was an inflammatory diet. For him, increasing pungent and salty foods would be hazardous. There was already too much nitric oxide. Katrina's diet, by contrast, was overly anti-inflammatory, and she needed more nitric oxide. Neither one of these are good, neither one of these is bad. You need inflammation, you need anti-inflammation. For Katrina, she had way too much anti-inflammation. For Bill, he was too inflammatory. If Bill took Katrina's advice and took the herbs which were helping her, it would further tip him in the wrong direction. The same herbs that could help Katrina would have a poisonous effect on Bill. I say this so that we all remember that what's good for the goose isn't good for the gander. We have to learn about ourselves, understand what we need, and once we do, you can use kitchen spices and the way you're breathing to affect most chronic diseases in a very positive way. Now let's look at dosage. Some people with chronic diseases will be frustrated because herbs or medications work the opposite way on them. They aren't simply nuts. There is a reason for this based on the cycles of gases in the body. This isn't an understanding that Western medicine is even looking at right now, and yet they should, because there are effects with gasotransmitters in the body, but they're not yet understanding how they cycle and how these can affect medications. When we talk about dose, we talk about high or low doses. This depends largely on the strength of the individual. This is difficult to assess purely on a numbers basis, because if people are in a weakened state or have gut dysbiosis with colon lesions, it can cause a rapid intake of medications. A little bit of pungent will cause the body to feel warm. Having a lot, as you do with a traditional Mexican diet, will cause the reverse and provide a pleasantly cooling sensation on hot days. If you have a little bit of chili peppers, it can cause your stomach to feel kind of warm. Why are Mexicans eating so many chili peppers when they live in a hot climate? If you increase the dose and have the levels of spice that you have in Mexico and Thailand, when you have the spice the way that they do it, it's actually cooling on the body because it causes the qi to exit first, which is warming, in order to enter, which immediately has a cooling effect. When you use a high dose, it can cause the opposite effect on the body. A little sour will cause a cooling sensation, but having a lot will have a very warming effect. There's a formula called sinisan, which is a traditional formula that uses bitter and sour herbs. It should be cooling, but because of the dosage and the combination, it can dramatically warm the body. It's even been used to treat hypothermia successfully. A little bit of the salty flavor will cause a generally sedative effect. If the dose is too high, it will cause qi to raise up. Lithium is used in the treatment of bipolar disorder. It's a salt and has a sedative effect. Sometimes, as people are increasing their dose of lithium, it will cause a manic episode. This is the reverse of what it should be doing. As a result, people lose faith in their treatment. Lithium is innocent. It's the doctor's understanding of gasotransmitters that is lacking. I remember this distinctly because my dad was on lithium for bipolar disorder and he was doing pretty well, and the doctor said to increase the dose. And he went completely nuts. He was flying into rages, throwing things. Why? It defied all reason. After he stopped taking the lithium, he ironically began to calm down, and when he went in to talk to his doctor, the doctor had no idea what had happened. I remember we went to see the doctor at his home. He had this bearskin rug, and the doctor just was shaking his head and said he had no idea. And I remember thinking, that doesn't cut it. There's got to be a reason underneath this. And there is. A little bit of salty medicines will cause qi to sink, but too much will cause it to sink in order to rise. And that rising effect happened as a result of having too much compared to the relative strength of the individual. The laws of botanical medicines and how they influence the gases are universal, but the application is as diverse as the cultures and people we find on this planet. We follow tendencies, but ultimately, each of us requires a healing modality as unique as our own fingerprints. We need to remember that there are times to sigh to expel qi out, to move blood circulation to the fingertips. There are times to yawn to bring blood circulation to the interior. There are times to use bitter to cause the qi to rise and to sink, salty to cause it to sink and rise, bitter to cause a drying effect on the body, and salty to moisten. There are times to cool the body using sour plants. There are times to warm them with pungent. How you use these within the context of your life will be unique, and the way that you choose to use them can also be flexible the more you understand yourself. I know it's a lot to take in at once, but it's incredibly important. This is what's missing in the transfer of knowledge from East to West. This is also the missing piece that can both unite Chinese and Western medicine and lead the future of medicine. And it's so simple that you can keep it as a treasure for yourself, to give you context for the next diet you hear about, the next super herb you hear about. If you know that it's bitter, you'll know right away if it's something you should or shouldn't be taking. This level of self-knowledge will reduce your dependency on experts. It will reduce your dependency and confusion on various trials coming in. Right away when I see something, I have a good idea of what it does. Garlic is white and it's pungent. Right away, I know it's going to increase nitric oxide. And then I can check. I can look on Google Scholar and lo and behold, it does just that. When you know nature's tendencies, it gives you a blueprint, it gives you a map for understanding all of nature's tendencies. It's not 100%, it's about 80%. But with it, it provides you context for how you can live and thrive in the world that surrounds you. If you want more information on this, go to www.botanicalbiohacking.com. Find the book Enlighten Weight. It's also on Amazon. Just look for Enlighten, like enlightenment, Enlighten Weight, W-E-I-G-H-T. In later episodes, we'll be going through various botanicals. I want to give both the folklore and pharmacology, but also the traditional understanding of how these flavors and gases are affecting the body as a whole. In the future, when I say this herb is bitter and sour, right away you should know, okay, its antioxidants are probably pretty high. And when we show the pharmacology and it says it's high in antioxidants, you should be like, oh, okay, that makes sense. That is probably going to have a drying and cooling effect on the body. And you'll be right. The idea isn't to go wide and get confused with the 10,000 plants that are medicinal on our planet, but rather to find those unifying factors to simplify it. As we go through these examples, you'll be able to understand at a deeper and deeper level how salty and sour and bitter and pungent flavors affect the plant's nature, affect the gases within our own body, and even our own gut bacteria. It's no small task to condense the plant-based indigenous wisdom of the entire earth, merge it with the pharmacology and the future of medicine. But that's what we're doing, and we're really glad you're along for the ride. The more of us who understand this and are looking in this direction, the better it will be for all of us at a societal level, at a cultural level. The mere fact that we're coming to the end of the age of antibiotics demonstrates that we need an alternative way of looking at the interaction between ourselves and the outside environment. We need deeper understandings of how the energy flows in the body, how these gases influence our cells, and how medications and plants are influencing these gases as well. The information's out there, it just hasn't been connected together until now. Please rate us. Please share this with your friends and family. If you know somebody in the health industry, please share this with them in particular. Because these are very simple concepts, and once applied, they could really pave the way for better quality of care for all of us. If you would like more information, references, or resources, please check us out at botanicalbiohacking.com. If you found this information valuable, please share it with your friends and family.